MayoClinic.org 2014, dementia involves damage to the nerve cells of the brain, which can affect several different areas of the brain. These include the frontal lobe, which affects intelligence, judgment, and behavioral, the temporal lobe, which affects memory, and the parietal lobe, which affects language. For 2 years, I've worked at Johnson Matters Nursing Home located in Carlisle, Kentucky. With my time spent there, I have mostly worked with dementia in the dementia and Alzheimer's unit. At some point in almost everyone's lives, they will come in contact or have to experience someone with dementia or Alzheimer's. So I think that it's very important for everyone to know about dementia. Today, I'm going to give you a brief insight on its causes, treatments, and the most common type of Alzheimer's dementia. Alzheimer's. There are many different causes of dementia today, and I've broken them down into a table which shows the risk factors that cannot be changed and those that can. The risk factors that cannot be changed are age, and they're 65 and older, which is the most commonly affected. Family history, Down syndrome, and mild cognitive impairment such as memory or thinking skills. Risk factors that can be changed are things such as heavy alcohol use, cardiovascular disease such as heart and blood vessel disease, depression, diabetes, smoking, and sleep apnea. According to the MayoClinic.org 2014, dementia can have changes cognitively and physiologically. These are also included in a table. Cognitive changes include memory loss. This is usually noted by a spouse or a family member. Difficulty communicating or finding words. Difficulty reasoning or problem solving. Difficulty handling complex tasks. Difficulty planning and organizing. Difficulty with coordination and motor functions. And confusion and disoriented. Physiological changes include personality changes, depression, anxiety, inappropriate behavior, paranoia, agitation, and hallucinations. According to Alzheimer's.org 2016, treatments for dementia depends on its causes. In the case of most progressive dementias, including Alzheimer's disease, there is no cure or treatment that slows or stops its progression. At this time, there are certain medications that can be administered that could temporarily improve symptoms like agitation, anxiousness, and paranoia. Some of these medications include Meditine, and this is a cognitive enhancing medication that's also known as Namenda. Ativan, which helps relieve anxiety in dementia patients. This helps them calm down. There are also other medications that may help relieve depression and anxiety. You can also use therapeutic treatments. These treatments include such things as occupational therapy, massage therapy, music therapy, aromatherapy, and art therapy. This calms them down and gets their minds off whatever it's on. According to the MayoClinic.org 2014, they say that these therapies can also improve symptoms. Finally, I want to address the most common type of dementia out of 9, and is Alzheimer's disease. According to Alzheimer's.net 2013, all the causes are not understood behind Alzheimer's, but most distinguishing feature of Alzheimer's is the buildup of the amyloid plaques in the tegu tangles in the brain. Plaques are abnormal clusters of chemically sticky proteins called amyloids that build up in between nerve cells, and tangles form inside of dying cells. And as you can see on the screen, this is what a normal brain would look like, and this is someone with Alzheimer's disease. Symptoms of Alzheimer's disease are things such as memory loss. Most Alzheimer's patients normally lose their earliest memory first, and then their most recent memories, so things that happened yesterday or minutes before. Confusion, difficulty communicating or finding words to say, anxiousness, and paranoia. The best example of paranoia I can think of is someone that has been in a house fire and they always think they see black smoke and they think their house is on fire, but it really isn't. The Alzheimer's Association says at this time there is no treatment or cure or delay to stop the progression of Alzheimer's disease. The U.S. government has made Alzheimer's research a high priority and set an optimistic goal of finding a cure by 2025. 1 out of every 3 senior citizens dies of Alzheimer's or another form of dementia. Dementia and Alzheimer's kills more people than breast cancer and prostate cancer combined. Dementia is a very common medical phenomenon, and I personally think that everyone should be aware of dementia. Dementia has causes that can be changed, like heavy alcohol use and smoking, just to name a few, and those that cannot be changed, like family history and Down syndrome. There are no known cures for dementia, but there are medicines like Ativan and Namenda that can temporarily improve symptoms, and music and massage therapies can also improve their symptoms as well. And as for the most common type of dementia, Alzheimer's, It's so complex that not a lot is known about it. So the government made it a high priority to find a cure by 2025, which is approximately 9 years away. So now that you guys know a little more in depth about dementia, I hope that you can see how serious of a disease this is and how it affects its patients.